All right, good evening, guys. This is Dr. Wynn Tran. Can you all hear me? Yes?
Yes.
Good.
Yes.
All right, could you do me a favor? If I'm talking, can you mute your microphone? Thus, everyone will be able to listen to our talk. All right, so how is everyone doing for the past 2 sections? Are you guys surviving? You okay? You think this is too much? Or what do you think? I'd like to hear some voices. Come on, guys. Okay, raise your hand or just turn on the mic and talk to me.
Can I say something? Yeah. Okay. So first of all, because it's near to the Teacher's Day, so I would like to take this chance to say thank you very much to our teacher. A teacher is a valuable opportunity for us to practice medical English. We can read a lot, but when we come to say in English, I finish not confident. I hope that after this class, everyone will become better and better. So thank you very much and congratulations on the Teacher's Day. For the past 2 sections, I think that it changed the habit of myself to practice English. So it seemed to me that I talk more and practice more by myself. And last night I talked with one of my teammates. She have a lot of condition. It's not narrow like we asking about the history approach to one symptom, but a lot of symptoms. So it makes very challenging in practice for me. But you can try it later. Thank you.
Excellent. I would love to hear more from you guys. And thank you for your wish. Okay, guys, let me repeat. I'm here today for you. So this is your opportunity to talk and to ask questions. Before we go into our lecture today, you can raise your hand anytime, and I like to have the class fun, okay? The way that I teach my class is make sure you guys all participate. If you want to sleep, this is not a good time to sleep, okay? If you want to check out your phone, this is not a good time. So focus and talk to me, raise your hand. And this is your time. I'm here because of you. So I want you to take this really, really good time and learn yourself and practice medical English. All right, I'm going to share my screen with you. And all right, let's see. All right, can you see my screen? Yes?
Yes.
And only this screen, right? I like to make sure I won't say anything else. Sometimes I share financial information about the hospital, which is not cool. So I'm just kidding. But sometimes you have to be careful when you like what to share. All right, I am going to discuss a bit about medical specialty and specialists today. Now, for full disclosure, I do not have any conflict of interest for this presentation. At the end of this talk, which is an hour and 57 minutes, I wish you learn about medical education model. This is crucial because some of you are practicing medicine already, but I want to bring you back when you were a student, a resident, fellow, intern, to realize that sometimes we're in different roles, different models, and we need to talk to our patient, to our student, resident in different roles to explain to them who we are so they understand the treatment plan. So this is our outline. We talk about U.S. medical education, specialist versus primary care provider, hospital staff versus outpatient staff, non-physicians, versus physicians. And we spend a lot of time talking about nurses. And let me tell you this, nurses are our best friend, not the enemy. Many of you think nurses are scared or because sometimes they could be rash, they could be difficult on you. But nurses, let me repeat, are our best friend ever. Okay, so think about it. And after this lecture, at least shake hand to nurses, say, hey, I'm your best friend. Okay, that's all I want you to do. So far, so good. Let me stop sharing a bit and see everyone's face. And I know that Dr. Jean and Dr. Doe, it's constantly check your screen, but I will do so. Because if you not on your camera or you do something else, as I say, I really want you to focus. And by the way, if you want to talk in Vietnamese, it's okay too, because this is a basic medical English class. However, I highly recommend you to talk to me in English. Try your best. Okay, try your best and try to talk. All right. Are we good so far? So far, so good?
Yes, it's okay.
Okay, excellent. Well, I like to make sure you are not sleeping. All right, keep going. Okay, so this is the overview of a U.S. medical education. And look at the center line, that's where you are. So we have pre-medical in the U.S., it's 4 years of college where you are going to prepare. You study biology, physics, math, all kind of things that prepare you to take an MCAT exam, help get into medical school. Now, when you are in medical school, which is right here, can you see my screen with moving hand? You see it?
Yes, and but can you make it better, larger? You can show it on full screen mode.
Yes, let me make sure that yes, you can see that. Where is my slideshow right here? Oh, right here. All right, is it better now?
Yes.
All right, so this is where you are, medical school and residency, right? And some of you are in fellowship or in training, so but this is where we are and where we are. And some of us right here, this is when you practice in medicine. So it takes a lot of time. You can see how old I am. I'm just kidding. But it takes so long to become a doctor everywhere, not just the US, right? In Vietnam, in UK, in China, and US. But it takes here at least 11 years to become a doctor. And if you want to become a specialist, it's 14 to 15 years. It would be a significant amount of time of your life to study. And when you finish up medical school, finish internship, finish residency, finish fellowship, you think you're done. No, you're not yet done. Even as a practicing doctor, you have to learn every year to keep up your license. So for me, I have to keep 100 units or credit hour every 2 years or 3 years to renew my license. So every 2 years, you have to learn 100 new medical knowledge. Just to tell you how crazy that one is. Think about that's equivalent 2 weeks full time to study. So every year, you need to at least study 2 weeks to keep up your license. So that's what it is. Now, just to mention, that is your general. You can study more, you can go to conference, you can teach resident, you can teach fellow, you can, so a lot of time to keep up your medical education. All right, so this is a fun time. So let me ask around you, see where you are at the moment. in this model, okay, on my left side, it's a young, beautiful student. It's a medical student, so very naive, have no idea about, or have a lot of idea about life. Student, usually the best dreamer in my team. All right, so whenever I run with medical students, they have the best dreaming idea. Their diagnosis way above and beyond. So they come with a very unusual diagnosis. And usually I will tell you right away, the medical student, because that's where they are. They learn a lot from textbook, but when it comes to clinical, they don't have much experience. A bit next to the right side is the intern. So this is the one just finished medical school and about to practice training under supervision. So the intern usually the first year out of medical school into residency. Now, this is where a lot of drama happen, okay? If you watch Grey Anatomy, all the crazy thing happen in Grey Anatomy happen a lot in intern and resident. Why? Because they in transition between medical school where a lot of textbook now into real medicine, real life, that residency. Now, after residency, you do usually 3-year minimum, and it can be 7 years as long as for neurosurgery. So residency, 3-year minimum, okay? And then 7 years at the maximum. So 3-year internal medicine, family medicine, emergency medicine, pediatrics. And now you go 7-year neurosurgery. And you think you're done? No, not yet. You spend more time in fellowship. Okay, fellowship you do 2 to 4 years more, depend how or what specialty you want to do. So that's another 2 to 4 years. And after that, you think you're done. Oh no, if you really want to study more, yes, you can do 1 or 2 more years. And then after all of that, you become someone like this lady we call attending physician. All right, so everyone had a concept. So I'm going to stop right here, go around the room and pick some of you, and you will tell me where you are at. I know most of you are students, but I want you to articulate to me what level you are at, and tell me your name, introduce yourself, and that's it. You don't have to take too long, but I want to hear your voice. Sounds good? All right, so let me call a random number because all of you have a number assigned, right? And let me repeat, you have internal medicine here, you have gynecology. Okay, I saw a hand, beautiful. Number 40, please.
Good morning, everybody. My name is Wynn. I'm graduate medical university in 2015, and I have not finished any postgraduate, and I'm difficulty to find my position in table you saw in Vietnam. After graduating university, some people can study high level, but most of them often work after that. After finish 18 months in certain specialized, we can we could have we will be provide a practicing certificate in certain specialized. So I difficult to find my position in the table.
All right, so let me tell you your position is, okay? If you're not in training, you are practicing. So you're on the right side. I know it's weird because you skip all the training, which is sometimes okay. But here, let's think about this way. you did go to 18 months of training, right? So that's somehow considered a kind of a residency internship kind of, but you are on the right side, you are on practicing medicine right now on the right side, not the left one. All right. Anyone else? Let's pick up your position and have some fun.
Hello, can I talk a little bit
Yes, please. Yes.
Hold on. All right, because the fan is too noisy. All right. So my name is Vanderlam. I enrolled in the Medical University of Ho Chi Minh City in 2010, and I should have completed in 2016, but I have to talk extra 3 years, and I was almost dropped out. And finally, I completed in 2019, and there was the program, which is the 18-month program in order to get the working license. So I took that program, and I completed it, and I get my working license. So now I still working and practice in a private sector, in a private clinic. And I don't have, usually when people complete their 18 months or they have the working license, in Vietnam, they go to the specialty level 1 and then specialty level 2. But I think I would not take that exam. I would not enroll in that program. So I think I am, so I consider the 18-month program is something like, is a part of my university training. It's not a residency. It's not a practicing. It's not attending. So I consider myself as an intern, and I just complete the university, and I have a working license. So that's it. Yeah.
Okay. Sounds good. All right. Anyone else? So two of you actually practicing medicine now, and you have licenses. I think in the future, the way that I see every country, include Vietnam, will have a required residency for all the doctor. I think that's the goal. I talked to several key people in Vietnam, key people in healthcare educations, and most of them agree that the Vietnamese government will moving forward with a required residency, maybe in the next few more years. But I think in the future, everyone, when you finish medical school, you will have to go to a graduate medical training. It's called residency, at least, or fellowship after that. But okay, who else? I'd like to hear more voice. By the way, you guys are excellent. You speak English confidently. I like it. Speak slow, speak loud and clear. Remember that we talk about that at the beginning, but I love to hear more voices. All right, come on, guys. Let's see. Number 23rd, please.
Right.
Yes.
Okay, good. Good morning, everyone, and good evening, our teacher. My name is Hian. Actually, I'm not a doctor. I graduate Ho Chi Minh University of Medical and Pharmacy in physical therapy, and I work as a physiotherapist. And certainly, I stopped my work and received a postgraduate course in Ho Chi Minh City. And because I'm not a doctor, so I cannot tell that who am I on the picture. Yeah, but actually, in Vietnam, because of many complicated, so I work at the physiotherapy, but in Vietnam, they didn't call us at a physiotherapist. They call us like a rehabilitation technician. Yeah, and our like Vietnam Physiotherapy Association were like now working forward to change our title to become a physiotherapist in the future, but now we are called as a rehabilitation technician in Vietnam. Yeah.
Thank you. Excellent. Number 62, please.
Yeah, my name is Phan Nam Phương. I just graduated from Medical University 3 months ago, and now I'm practicing 18 months to get my working license. And after that, I want to apply for some basic courses in ophthalmology. Yeah, and now I don't know. I don't know where I am on the table you draw on your slides, but maybe I'm intern. Is it correct?
Right. Intern will be sufficient. Yes. Yes.
Yeah. Thank you so much. Yeah.
And guys, don't be afraid.
I ask a question.
Yes, go ahead.
Okay. I know that the period to become a doctor is very long time in many countries, but can I ask the price to become a doctor in US? Because you say that around 9 to 11 years. So during the like resident or intern, do you have to pay for the education fee, or do you have the salary during that period?
Excellent
Thank you.
No, you get paid. So let me briefly tell you how, and this question people ask me a lot, and how much, and this is, so 11 years is the minimum, but the moment you finish medical school, you will go into be intern, we pay you. I mean, we mean the hospital, the clinic, and the intern salary in the US is $50,000 a year. This is about the average income of the US people, okay? After residency, your salary increase 3,000 to 5,000 a year. So you second year resident, you make 55 to 60, depend in Los Angeles. Los Angeles, we pay a bit higher, we pay 60 something. And then after you finish fellowship, you finish residency. If you want to go practice, then your salary will increase 3 times. So usually about 150 to 200,000 a year. And then if you don't want to, you go to fellowship, you spend more time to learn, then you get paid. But as a fellow, you pay about 7 to 90,000 a year. And after that, as a fellowship graduate, yes, as a specialist, you will get paid more, between 200 and 300,000, sometimes more, depends on the location. But let me tell you one thing, the US medical student loan, they have to borrow a lot of money to get into, to pay their medical school. The average student debt in the US is about 250,000 or 300. I mean, student owe a lot of money. If the two of you, husband and wife, are doctor in the US, and I will tell you they owe a lot of money. So it takes a long time. It costs a lot of money, but you will get paid a intern or resident, and you have other benefits. So in effect, I talked to several people in the past, a resident or intern in the job here, you have insurance, you have everything, all the benefits, we pay you, because I pay my residents. So we have all the program and we pay the residents. So it's actually a job. You have to finish your job in order to promote into next year. Anyway, those are great questions, okay? And as I said, this is your time, so you can ask me as many questions as you want. But let me move on, okay? And then we join back to question. But I want you to be awake, okay? I don't want to see sleeping face. Think about, I work a lot today, guys. This is 6:24 p.m. California time, and I'm still with you guys. Okay, so I want you to be fully awake. I know this is 9:30 in Vietnam, right? So still awake. Did you drink all coffee this morning? You drink coffee? Yes? Okay, Starbucks or just Vietnamese coffee? All right. I'll tell you one thing. Vietnamese coffee, very strong, okay? I have Vietnamese coffee and I almost have a tachycardia, like my heart rate go up like this. So Starbucks is okay to me, but Vietnamese coffee, very strong. Okay, guys, let's keep going on where we are at and let's see. Share. All right, you see me back right now, right? All right, so this is where you are. And actually that question that who pay a doctor, someone just asked me, right? This is the graphic to show you. Now, why I show you this in medical English class, right? Why I show this to my student? Well, because let me tell you, finance is the number one thing all my resident students and fellow have no idea about. I don't know. Someone teach you finance in medical school. I will tell you, in the US, you must know finance. You must know because this is money. This is your money. I mean, at some point in your life, you have to deal with this. So I tell you right now, very brief, who pay you? Is a doctor in the US. Well, a lot of people, but in general, who pay doctor in the US? The US taxpayer. Okay, you pay tax, and that tax going to, you see tax roll right here, and then premium, whatever. And we use tax to fund education, to fund medical education, to pay to train doctor. All right, to give you a very brief idea. Okay, now let me ask you, how many specialists you think out there? I have the number right there, but how many you think? Let me just stop right here and ask people around. How many specialty you think in Vietnam or whatever you know right now? Tell me. Well, you can count your number by hand, but I will guarantee your hand, fingers, and your leg, toes were not enough. All right. So how many specialty you think in medical field, whatever, how many you know? Tell me a number.
I guess 30.
30? 30? Okay, I like that number. Okay, I need another number. Okay, guys, come on, turn on. So let me call number 72. Who is number 72? Let's see, who was 72? 72, are you there? Yeah. Yes. How many specialty? Yes. All right, how many specialty you there?
I think it's 40. Yeah, it's more.
40. Okay.
Yeah.
40. I love number 40.
Yeah.
Okay. How about 72? I pick a random number from you guys. Okay. Who is 72 on my screen?
I think in Vietnam have about 50
Teachers. Yes.
50, yeah.
I count specialist in your handout. I see there are 24 specialists in Vietnam. I think in Vietnam.
24. Oh, okay. We'll get to that. We'll get to that, guys. Okay. So 24. Yes. So that's a number right there. Okay. I need another number, guys. How many? Come on.
I see in Hanoi Medical University. There are 37 after graduates in specialized for doctor specialized graduates first or second master who can register. So I think for 37 in Vietnam.
37. Okay. How about number 11? I saw your hand raise up. Number 11. Yes.
I would like to say 13 specialists in Vietnam because that's just my favorite number.
Okay. 13, or you mean 13 or 30?
13.
All right, guys. So let me tell you the number, okay? And I want you to write out this number down, okay? And you will see in my screen right now. All right, guys, over 160 specialty, 160. And the number is keep coming up, all right? And after this website, you can go to AAMC Career in Medicine and look 160 specialists. You say, what the heck is that, Dr. Tran? Why so many of them? Well, the reason because a human body is a complex body, and this number still keep coming up. And someone mentioned about 24, and I will explain to you why. 24 is the number board specialty. So within a board, so they subdivide. For example, board of internal medicine have 20 plus subspecialties within that board. So board of internal medicine have cardiology, gastroenterology, hematology, oncology, rheumatology, all the ology that you can think of. So we have a lot within one board, right? Now, within board anesthesiology, there's pain medicine, there's a lot of regional pain, whatever. So there's a lot of them right there. Well, but I will tell you here. So this is the 24 medical board. From the left to the right, those control 160 specialty. So the medical board control medical specialty. Makes sense? So the board, one board can control many specialty and could be overlap between medical board. For example, sport medicine can belong to board of internal medicine, but also belong to emergency medicine, but also belong to family medicine. You see that? So one specialty can belong to many board members. So 24 overall, but oversee 160 medical specialty in the US. Now, I know that Vietnam is growing, so I can tell you the number right now is more than 50. And that's my understanding in Vietnam. And the number will continue to grow based on you guys, because you are the future. You will become whatever specialist. Now, this is going to be a fun part. I will tell you. This is one of the most interesting specialty that you may heard on. You never heard about them. Okay. The number one is aerospace medicine. Have anyone know what are the doctors doing? All right, so aerospace medicine are NASA doctors. So NASA, NASA, they send they send astronauts to the moon, to the Mars. And guess what? In the moon, we have a different environments, right? The gravity is different from the Earth, and everyone going there have osteoporosis. Okay, they're born because they almost have much different way compared to where we are. So aerospace medicine or aviation medicine deal with people go into space, to airspace, whatever. And this specialty training usually happen in the US military. So you either go into the Navy, the Air Force, but become this really cool specialist. And you deal with alien, you deal with astronauts, you deal with something outside right there in the orbit, okay? Not in the US and not in the Earth. All right. The next one we call nocturnus. Have anyone idea what nocturnus is? So nocturnus is the medical specialist take care of patients while they sleep in the hospital. All right. So we sleep 1/3 of our life, right? So we need someone to look for what happened when we sleep. And this is the specialist that's taking care of people while they sleep in the hospital. Now, another one is cool called lifestyle medicine specialist. So this is for people who need to change their lifestyle. They need to eat diet better. They need to exercise. They need to improve their health based on lifestyle. This is a very cool specialty because guess what? Your clients a celebrity. So super movie star, Korean movie star are client of those doctors because you are the lifestyle specialist. You, based on patient, you will change their lifestyle to make a better life, make them sleep better, make them do better job, make them losing weight. So that's your job. The other one is called clinical informatics. This is the specialist dealing with information, but clinical information only. So they extract the data, they combine data, they put together and file a treatment plan for the patient. Medical virtualist is another new thing that telemedicine specialist. So you don't see real patient, you see patient via computer like this, but you are specialist. So you talk to patient distantly, like long, and you see the patient. And the other one we call cancer immunologist. So this is the immunologist based on gene, based on immunotherapy to treat cancer. So those are some that are cool specialty that I like to share with you. And you may not never heard about those specialty, right? But this is something very cool. And let me stop right here. And we go around and you have to tell me again, your specialty or what are you interested in, okay? If you are a student, think about specialty. I need a volunteer. Otherwise, I will call a number, random number here.
Can I be volunteer?
Yes, absolutely, please.
I am interested in general practitioner, GP.
Okay.
Because I think it's very broad and many things to learn, but not to. Sometimes it could be very complicated, but I think it's not too difficult as being a certain specialist, like focus on one organ. So being a general practitioner, I can assess my patient as a whole, and that's what I like. I want to understand the human body, and I will also have many patients, not just a patient with heart problem, but I will assess, but I will treat many patients, and yeah, that's it. That's what I like. General practitioner, GP.
Excellent. Next one, or I have to pick a number.
Can I say something?
All right, number 70, please.
Yeah. I work as a pediatrician in a private hospital. But sometimes I have some idea. We become lifestyle medicine, because in Facebook, a lot of people call them coaching, sometimes the information they give to other people is not good, maybe harmful for each other. And sometimes I think if we improve the medical lifestyle in lifestyle medicine, it can help a lot of people to change their life and become maybe healthy.
Excellent. I like it. Okay, how about number 61? All right, number 61, are you?
Yes, thank you, teacher. I am a doctor. I am taught. I work in a hospital in Hà Tĩnh, a major town in Vietnam.
Thank you.
I work in endocrinology. I'm a diabetic doctor.
Excellent. So yes. Endocrinology. Okay.
Endocrinology. Yes, I am endocrinologist.
And so you are an endocrinologist. Okay, so endocrinologist.
Endocrinology.
Yes.
Yes.
Okay, guys, what is the most difficult specialist to spell? Okay, let's go around. See, what is the most difficult one? What the one that even, okay, go around.
Yes.
All right, number 77.
Good morning, teacher. Yeah, I'm work as an embryologist in IVF center. I'm not a doctor. I'm master of science.
Thank you.
Yeah. And sometimes I focus on genetic also.
Fabulous. All right, how about number 40?
I'm a pediatrician because I love children, and I also want to take care of my baby in the future the most. Thank you.
All right, so pediatricians. Now, guys, I will try to speak slow, specialist or the name so you can follow. Pediatrician. So that's what it is. Endocrinologist. All right. Now, you don't have to speak fast. I told you at the beginning, right? Or you need it slow. Okay, now this is one of the most difficult one, and even you as medical student have problem. You know what is that one? It's called otolaryngologist, ENT doctor. All right, you know how to spell that one, but it's a long name. The other one's ophthalmologist, but otolaryngologist is one of the most difficult one, and student here have problem. All right, so you break down the name of specialist and you just slowly go cardiologist, rheumatologist, dermatologist. Go very slow. You don't have to go really fast. Okay, go very slow. If I am a that's too slow. Okay, dermatologist. Go slow, but not too slow, but not too fast. Okay, I'm a gastroenterologist. Okay, gastroenterologist. You see that? A GI doctor. Now you have to spell your name correctly, right? Otherwise, people want to know, okay, who are you? It's and then you say, oh, I'm an ENT guy. I said ENT. Yeah, it sounds cool. But how about, well, I'm an otolaryngologist. And I said, wow, that sounds very smart, right? So sometimes spell your name correctly, people think about, oh, it sounds very smart. Well, you may not be that smart. It's okay. But spell your name correctly, your specialty correctly will give people some good idea. All right. Let me keep moving on and see where we are at right now. Let's go. Okay, guys. Now, specialist provider, in general, they train them longer than primary care providers, an average of 14 years versus 11 years in the US. And why I say 11? So 4-year undergraduate, 4-year medical school, 3 years of residency for family doctor, internal medicine or pediatric. Now, they usually focus on 1 or 2 single system. Okay, if they focus on the vascular system, they are cardiologists or vascular surgery, or they focus on a region of the body. Usually, for example, OBGYN, gynecologist, or ENT, they focus on the face, the ear, and the throat. Now, they train as a generalist before they become a specialist. Now, because of that, many specialists can see general problem. Does it make sense? For example, a cardiologist can easy see general medicine problem, but some of them, after a while, they practice, they focus too much on cardiology. They don't do general medicine anymore. But yes, many family doctors in the US could be cardiologists. A rheumatologist like me, I see a lot of specialty patients, but also I can see primary care doctor. Now, even within a specialty, we have subspecialty. It means for example, cardiology, we have electrophysiology within cardiology. We have interventional cardiology within cardiology. So what does it mean? It means after you finish cardiology fellowship, you have to train more to become a subspecialist. You focus so narrow on that particular specialty. For example, as an electrophysiologist, okay, electrophysiologist, it doesn't sound like doctor, right? It sounds like physiologist. No, but they're doctor. Electrophysiologists, they focus on the heart electrical system. If anything wrong with the heart electrical system, you send to electrophysiologists. Okay, that's what it is. All right, so interventional cardiology, you know this specialty, right? This is very famous in Vietnam. A lot of people in Vietnam, residents, students, want to become an IC interventional cardiologist, well, because this is a high pay, good, I'm not sure good lifestyle, but a very well respected, right? A lot of doctors in Vietnam respect cardiologists, interventional cardiologists. And I have few good friends in Vietnam of IC, and they are fantastic doctor. All right. Now, let's talk about primary care provider. They are the backbone of the healthcare system. Let me repeat, they're the backbone. They're very important. Now, a lot of time we forget, or we think we special, we think we're better. I don't want you to think like this. Primary care doctor and specialist doctor are left hand and right hand. You guys need together. You cannot exist alone. Primary care doctor needs specialist need primary care doctor. All right. So that idea had to go hand in hand. Even one day you are becoming a specialist, always think you could be a primary care doctor somehow, because you need both. Okay. In the US, there are 4 common specialties to become a primary care doctor. You can either choose to become a family medicine doctor, internal medicine doctor, or internist, pediatrician, or a gynecologist, or an obstetrician, or OB/GYN. Now, sometimes emergency medicine can be a family doctor also, because if the patient have no insurance, think about it. If you have no insurance, you have nowhere to go. So where do you go when you have a problem? You go to the ER. You go to emergency room. And in this case, emergency room will be your family doctor, your primary care doctor, and then they will call a specialist if you have any problem. Of course, they treat you only for emergency problem. When I say emergency problem, means something that dangerous to your health if you don't see doctor right away. Now, all the specialists or all the non-physician primary care provider can be work alongside with you. We have nurse practitioner, we have physician assistant, PA, or a new one is called pharmacist, right? We'll talk more in the later on, because the role of the pharmacist has increasingly become important in the US, and I'm sure it will be in Vietnam too. So in summary, a good healthcare system needs both specialists and primary care provider work together. We need both. There is no one better than the other, okay? Now, let me stop right here and then go back to the class, because at this time, you know, you either become a specialist or become a primary care doctor, right? Or you could be both. So let me talk to you more. What would you like to do? Continue this. Let me call a number that I have not heard a voice by far. Come on, guy, volunteer. Show me your enthusiasm. Talk to me like I haven't not. Let's do number 46. Just happened on my screen.
So, good morning, teacher. I work as a primary doctor in emergency.
Okay, excellent. So let me ask you one more. Are you trained or were you trained as a primary care doctor, or you just want to become an emergency doctor?
I just work as an emergency doctor in 2 years.
Okay. All right. Excellent. Let me find a different number. Let's start with number 1. Where's my number 1? I don't want to see my screen. Number 1. Who is number 1?
Good morning, teacher. I am a 4-year student, a medical student. So
Hey, so what are you interested in? You have an interest in medicine or specialty?
I want to be a cardiologist, doctor.
Cardiologist, okay. All right, so we have a lot of good heart here, right? A lot of heart doctor, yes. All right, cardiologist. All right, let's see number, let me pick a good number here. Number 25. Hello, 25, where are you, 25? Let's see, where's my screen here? 25. Oh, I saw it. Oh, I see just Hawaii, ocean. Oh, 25 in Hawaii. All right, so time 25 is not there. Let me pick number 69 next to 25.
Good morning, Dr. Wynn. I'm not a doctor, but I'm a clinical pharmacist. I'm working at the hospital now, and I would love to specialize in infectious disease because I recognize that the antimicrobial resistance in Vietnam is quite a big issue. So, and also during my working in the hospital, I find that the doctor really appreciate the opinion from the pharmacist about how they can choose the antimicrobial correctly and how they use them appropriately. So I think if I specialize in infectious disease, so I think I can help doctors a lot. Yeah.
Thank you. Thank you. I do believe that you guys are so important. Okay, let me tell you again, so important in medicine, and thank you for being a infectious disease specialist, pharmacist. I have a lot of cool story about, we have no idea how to treat this bacterial, this bug. And the pharmacist, the specialist one come and, hey, yay, you this one. And then bingo, it's our problem. So we need clinical infectious disease specialists like this pharmacist, which I will talk to you a bit in the next hour when we come back after the break. All right, let's see number 79. Hello, 79. Can you hear me, 79?
Yes.
All right, 79. What team are you and who you like to be? What type of specialty that you like to be?
I want to be an oncologist.
Oncologist. All right, excellent. So you want to be a cancer doctor, right? Okay. Now, what team you are in, oncologist?
I don't know about that. So.
All right. I think Dr. Dean assigned you guys to 10 team, right? We have, because I want to make sure everyone know their team member. For example, you guys, some of you are internal medicine, some of you are gynecology, some of you are, I believe, surgery. All right, let's see. 82, no, 83. I saw a hand. 83.
Yeah. Good evening, teacher. My name is Jung. I have no idea whether, excuse me, can you hear me clearly? Can you? Yeah, okay, thank you. I don't know, I have no idea whether anyone in the class is a nurse, but actually I'm a nurse. Yeah.
Wow.
Yeah. Despite so far as I know, no specialties in nursing in Vietnam. But if I can choose, I will. I will choose geriatric nursing because I have an interest in the elderly care, and when I finish when I do the dissertation in my master class in Australia, I have a topic in patients diagnosed with dementia in nursing home. So if I have a chance to study PhD, I will continue to research more about the geriatric care. And by the way, I have a question relating the geriatric nursing in US. Could you please show me, share something to me, please? Thank you.
Yes. In the second hour, in the next 30 minutes, I will talk to you about nursing, about non-physician specialty, and yes, we'll come back to that point. All right, I saw another hand, number 91.
Teacher, I'm new, and my specialty is traditional medicine. You know, traditional medicine. In Vietnam là massage, acupuncture, or use the help us. And in the USA, in the either this study, I don't know.
Yes, that's what we call Oriental medicine. Oriental medicine, and sometimes we call Chinese or natural medicine. So we do, there's a specialist here, especially in California. We have Chinese medicine, with Oriental medicine, with natural medicine. They have different type of doctors, and sometimes I'm confused to everyone doctor. So anyway, let's see. Let's pick okay, number 73.
Hello everyone, my name is Tai. I graduated from internal medicine residency program at Hanoi Medical University in 2020. And now I'm on my way to become a GI doctor.
Excellent. Wow. So you are a GI fellow at the moment, right? So you kind of move toward my right hand to become attending physician, right? So challenging for you. How do you call yourself? Don't call GI, okay? Just
I am a gastroenterologist.
Yes, you see the gastroenterologist. You see the enterologist very slowly. Gastroenterologist. See, very easy, guys. Just take it easy. You don't have to go fast. Just I'm an endocrinologist. See that? Very slow but simple. All right. Let me call a number here, number 45. Number 45, please.
Good morning, teachers. My name is Tran. I'm an oncologist.
Oncologist?
Yes.
Right.
And my specialty is medical oncologist.
Yes, thank you. Okay, guys, even oncology, they have several type of oncologists, right? We have radiation oncologists, we have medical oncologists, we have surgical oncologists, and we have a new one we call interventional oncologists. Do you have any idea who are they? All right, so let me go back to my oncologist. Number 45. Can you tell us the difference between medical oncologist and surgical oncologist? Number 45.
Medical oncologist, that duty is, my duty is diagnosis and use chemotherapy to treat the patient, and surgeon oncologist, surgeon oncologist, the operative to cure and remove the tumor of the patient. I think it's difficult.
Wow, but you're coming there. It's good. Okay, so medical oncologists, they use medication. Okay, medical medicine makes sense. So medical oncologists, they use medicine to treat cancer patients. Make sense? Surgical oncologists use surgery. Make sense? Surgical surgery because they are surgeons. You see that? Surgical oncologists, they use surgery to fix or to operate cancer patients. Radiation oncologists use radiation, use the beam with energy, right? You focus your beam of energy to burn the tumor. And lastly, interventional oncologists, they use image guide procedure. They go into a body, go into a tumor, and they deliver chemotherapy to that location precisely. So some specialists, they interventional oncology call themselves precisional medicine, precisional medicine. All right, does that make sense? All right, so let's take a 5-minute break, just 5 minutes. Okay, I will come back in 7:06 and we'll finish our lecture. Okay. All right, class. All right, so let's keep moving and finish on time. All right, everyone still with me, or you sleep now? Or it's in Vietnam, it's in the morning. All right, guys, let's keep going. All right, this is a hospital structure. I don't know how many of you work in a hospital, but this is to give you an idea, very simple, but also complex structure of the hospital. Now, a hospital in the US usually have many departments, but they divide into two big, you can see that. One, medical staff, you see on my right hand side. The other one is nursing, everything their department, such and such and such. So you may wonder, so where the doctor belong to in this chart? Usually the doctor belong to medical staff on the right side. Now, medical staff is very powerful, as I told you, very powerful board, because they have different voting, they have different election, and then they control differently by different people. On the other hand, on your left hand is nursing, they also control the hospital. So to tell you this, because nurses and doctors work together, but in the hospital setting, most of the time, doctors are not hospital employee. They belong to medical staff. They belong to medical group. Make sense? So I want to make sure that in Vietnam, the hospital usually employ doctors. in the US, hospitals usually they do not employ doctor unless they work for a larger organization like Kaiser or other thing. But this is to give you a simple hospital structure. All right. Now, when you send a patient to the hospital, you go into either by usual admission or emergency room, right? So emergency is where everyone can go 24/7. It's easy access, right? You go to the ED. Now, over there, you may wait sometime 2 hours, sometime 10 hours, sometime a day, depends. But ED is a lot of things happen in the emergency, a lot of things happen there for the hospital. So let's start with this level. Now, in the emergency room, you have nurses to help you triage. We can triage mean to screening, to kind of classify whether this patient is very sick, this patient not so sick. So they will move the sicker patient go toward faster versus the one that not so sick, they can wait. Now, if a patient is admitted to the hospital, so we have nurses in each floor, we call medical floor, we have surgical floor, ICU floor, nurses, cardiac units, etc. And let's move to a different name in the hospital. A doctor who taking care of hospital patient, we call hospitalist, okay? This is a very important doctor because in order for a patient to be admitted to the hospital, there must be a doctor to accept and oversee the patient. And we call them hospitalist. Easy, right? Because they're in the hospital, right? So hospitalist, that's the name of the doctor. Now, the ED doctor, you already know, but moving to that, there's an ICU doctor, and I want you to call them intensivist, right? Why intense? Now, so that's the name intensivist coming from. Very intense medicine, right? Very, very critical. So intensivist, so that's the name. So after this lesson, make sure you guys don't call yourself ICU. Hey, I'm intensivist. Make your name very serious. Okay, talk to your friend. No, I'm not a GI doctor. I'm a gastroenterologist. Okay, it's very serious sound. I'm an ophthalmologist. Okay, I'm a cardiologist. I'm an ologist, whatever ologist out there for you. But try to practice it with your friend. Hey, I want to become an oncologist. Or if you want to be very fancy, oh, I want to become plastic surgeon. Okay, or cosmetic surgeon. Okay, I want to become a breast surgeon. So something that's very specialty, but try to practice your specialty or your dream specialty you want to be. Now, this is one of the funny one because people sometimes they cannot pronounce this one. Anesthesiologist. Okay, so you break it out. Anesthesiologist. Make sense? So you see, when I teach you those medical terms, if you are breaking them into smaller one, don't go too fast, don't go too slow. Just anesthesiologist. That's what it is. So those are doctors that in the anesthesia to make your patient sleep. And then within the hospital, we have specialists, we have surgeons, we have internal medicine specialists, we have all kind of them, cardiologists, oncologists, rheumatologists, infectious disease, and etc. Now, moving to a clinic outside a patient, outpatient, then we have those staff. So usually there's a doctor provider, and then we have nurse practitioner, we have PA, physician assistant, and we have an office manager, and then we have an accountant. Obviously, accountant is very important because someone needs to oversee money. And then we think that we have nurses, we have LPN, we have medical assistant, we have ancillary service personnel, like people that draw blood, phlebotomists. So those are the terms that you may heard about. And then we have coding, billing, we have transcription, we have, lastly, but important, housekeeping. All right, let's talk about nurses here, guys. And I'm so happy that we have a nurse here. Finally, yes, there's a nurse in my class. Well, I teach nurses in Vietnam many years ago, but this is one of the first time we all together. We have a pharmacist, we have a physical therapist, we have a nurses here, and then who else? Let's see. Let's stop right here. So who else I haven't identified here? We have nurses, we have PT, we have pharmacists, we have all cardiologists here. You guys. Who else I miss in this class? Is anyone here occupational therapist, OT? Raise your hand. Okay, so I don't see it. All right.
Actually, in Vietnam, we did have the first course of OT graduate maybe last year. Before, as a PT, we have to work all of the rehabilitation team, like an OT or an PT. But we have some like international government organization support for educate the OT. So in Vietnam, we did have the first course of OT graduate. So I don't think that they
all right, excellent. We'll talk about it later. Okay, but this is so fun. I like to have more people like this on board. All right, guys. So let's go back to the sharing screen and see where we are at. All right, let me repeat again. Nurse is your best friend. Okay, I've been there. I trained as student, intern, resident, and fellow. I will tell you, sometimes at that time, I did not like nurses. Some of them could be very mean to you. But if you think about it, they're not mean to you. They mean to protect our patient. All right, so if you, for example, you go into the OR and you scrub in and you wear a wrong scrub or you touch something, you contaminate everything in the OR, guess what? The patient will be harmed, right? So nurses OR, sometimes they very strictly yell at you and say, Mr. Tran, you cannot touch that. That's dangerous. So that's what nurses are. They are to protect our patient, not to be mean to you, okay? So a lot of time when I work with nurses later, I will tell you they're my best friend because I know they act on behalf of the patient. Just like us, we want to protect our patient. So I want you to think this way. Even nurses, sometimes I know there's some friction among us, and I acknowledge there are friction there, but they my best friend. All right. Experience, I told you, experienced nurse can give you a lot of good lessons, so for example, I learned how to do IV from my best nurses, okay? And let me tell you my experience. When I was a student and I run a free clinic, and at that time we had to draw blood for patients, and I learned from one of the best nurses over there, and she taught me how to get IV access just like this. And because of that, we're able to draw many blood from patients. And the experience taught me until today to tell you how grateful we are if we can find good teacher. All you need is just ask, hey, can you teach me? Hey, can you help me? Can you show me how to draw blood? And very simple, but powerful. Forget about your doctor, forget about this. Just if you don't know, ask, right? Sometimes doctors think they know everything. And let me tell you this, you don't know everything. I am an attending physician, I teach resident fellow for many years, and I still say I don't know. And to be honest with you, a lot of things I don't know. So when we don't know, we ask for help, it's okay. So put your ego away, please, okay? Sometimes doctor ego too bigger than the face, okay? So put the ego away and ask for help. Ask for help from your colleague or whatever, nurses, PT, to learn from them. And guess what? The moment you ask, you know what they think? They respect you more. I guarantee you, the moment you ask to learn from the nurses, they really respect you. Because why? Because you are really, truly good doctor. You want to improve your knowledge, all right? Now, we'll talk a bit about nursing degree, as some of you asked me here. Now, in order to become a nurse in the US, there's many options. You can go straight from high school, to become a Bachelor of Science in Nursing, BSN. This is a traditional 4-year. And after this, you take a license. Now, you have to realize in the US, degree name doesn't mean license, okay? RN is a license. It's a registered nurse. BSN is a degree. So sometimes people put degree and license together. For doctor, we have only MD. It's just license, the same with the degree name. But if you think about it, in the US, degree name and license are different. So after you get your degree, you're eligible to take the board exam. And if you pass your nursing board exam, you become an RN. You become a registered nurse. At that time, you can see your patient on the floor in the ED. Now, after you become a nurse, BSN, if you want to study more, become a master level, you have MSN, Master of Science in Nursing. And now you can try to become independent. We call nurse practitioner. So a nurse practitioner is, you can work with your doctor. In the US, there's 26 states allow you to practice independently. The 24 states include California. You need a physician supervision. But in my opinion, I think we need to work together as a team. That's how I see it. Now, if you really want to become a very high end of nurse, that's a degree name, Doctor of Nurse Practitioner. And you ask me, is there a doctor? The answer, yes, they doctor degree, but they still nurses. So you have to realize that degree name doesn't mean doesn't equal title. Make sense? So you have a doctorate degree, it doesn't mean they're not the same. So make sure you're clear on this. Okay. Okay, let's move on. A nurse practitioner versus a physician, you see this model a lot because nurse practitioner, they can see patients by themselves in 26 states. They have a lot of experience. They can educate, they can teach the patient, they can make diagnosis, they can order tests, they can analyze test results, sometimes in collaboration with the physician. Doctor, on the other hand, we have longer training and responsible for more patients and legally. If they sue you, they want to sue doctor, they sue nurses too, but I will tell you when you go to court, a doctor, you get more responsible. The church will look at you and say, Dr. Tran, you are responsible for this because of this and this conduct, even though that was your nurses. So doctors still always take responsibility when a lawsuit happened. All right. Now, let me spend some time talk about other specialties that you should know for your practice. The number one, the second best friend is my pharmacist. I will tell you why, because pharmacists in the US, they're doctor too. They doctor of pharmacy after 4 years. And now almost pharmacists in the US, they have to go to residency at least 1 year to become a practitioner or pharmacist. Now, after 1 year, if you want to become a specialist, more like someone here mentioned here, you can do infected disease residency for pharmacy. You do 1 or 2 more years, become an ID specialist. Now, if you want to become a practitioner independent, like mid-level, you go to a different route. We call advanced pharmacist practitioner. Very similar to NP or a PA. They can see patients by themselves. They have their own license, they have their board, and they're excellent provider, and they can be their family doctor. So this model will become more in the future, but now in California and in other states, the role of pharmacists increasingly important, and they are soon become a provider. Just like a nurse practitioner or PA. The other one is optometrist. Optometrist is the one that fixing glasses and they take care of the external part of the eye. They do not do surgery. However, their role are very important. If you are having problem with your eyes, like me, if I want to correct my lenses, I am going to see an optometrist. Now, guys, you know the difference between optometrist versus ophthalmologist. You know the difference, right? So optometrists are not physicians. Ophthalmologists physician like us, we have to go to medical school and then they do a 4 years of residency to become an ophthalmologist. So you say ophthalmologist. Okay, so that's how you spell yourself. I am ophthalmologist. Okay, versus I am optometrist. Now there's another one called optician. So optician is the one that's doing just glasses. Physical therapist is another important health profession that you should know, because physical therapy is one of the best treatment for joint pain, for joint problem, for muscle problem, injury, stroke, etc. And let me tell you one of the fun thing about PT, they have so many specialty within themselves. Okay, so they have OB. Okay, so your question, oh, Dr. Tran, what the heck in the world of physical therapy doing OB? What happened to the baby? What happened to the pregnant ladies? The answer is yes. So if you are pregnant, you need a physical therapist to teach you how to move so you can deliver the baby sufficiently, the baby the best way you can. So this is something I learned just recently. I say, that's so cool. So that means the physical therapist dealing with pregnant lady all day. That's his job. And it's so funny that you see that you teach this lady to move, to walk, how to carry handbag, how to carry grocery store, to make sure that her posture not impact the baby. Is that interesting? So that's PT. Now, we have occupational therapy. You may wonder what's the difference between PT and OT. They sound similar. No, they're not. So physical therapy teach patient with movement, physical, to regain their function, to treat their problem. Occupational therapy to teach patient with their daily activity, how the patient eat, drink, how they put in clothes, how they tie their clothes, those kind of things. You need an OT. Make sense? So if you have a stroke patient and you stabilize the patient, you treat the patient, now the patient would like to go home and the patient would like to spoon feed themselves. It sounds easy for you because you don't have stroke. But let me tell you, if there's a spoon right there, let me tell you, this is a spoon. And I'll tell you, this is if I have only one hand and my hand is stroke, this is very difficult. And this is extremely difficult to feed someone like this. So think about it. We need specialists like this to help our patient. So occupational therapist, very important in stroke patient. Now, moving on to speech therapists, we call speech language pathologists or speech therapists. So those are the people that problem with stroke, they cannot talk or they blah, 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 like this. And you need someone to help to pronounce, to say A, O, you do this. And think about it, they do very slow. And they would, if you need to, they can teach you how to spell endocrinology, something like that. So speech therapists teach patients how to talk, how to restore their speech before the stroke. All right. Nutritionist, on the other hand, is the one that specializes in nutrition, in food, in therapy using food, and you need those people to teach your patient how to select good food. Let me stop right here and ask you this fun question. How many of you can or think you are a good nutritionist, or you can confidently advise your patient about diet or food? Think about it. Are you able to tell your patient what is nutrition, how to eat, how to select this vegetable, how to pick this? Think about it. The answer is likely no. You know why? Because medical doctor learn so little about nutrition. And so the question, how do I learn about this? Doing residency. I will tell you, medical school, we barely teach medical students about nutrition. But in residency, that's where you practice medicine. You teach your patient every day about your diet. And sooner or later, every day, I told my resident, hey, tell your patient, change your diet. What diet? Okay, diabetes diet. And so what is diabetes? So my resident have to look up, and he found what 100 diabetes diet. So Dr. Tran, there's so many, which one should I do? And ask himself, okay, you have to tell me, you as a learner, you tell me what is the good diet. And my resident spent a lot of time reading about, and after he said, none of them are good, Dr. Tran. And I said, that's now I know you know, because there is no one good diet to fit everyone. You have to find out your patient nutritional status. Do they lack protein? Do they need carbohydrate? Do they need fiber? Why they need this? And that's why you like to become a nutritionist. My point is you need nutritionist for your patients. And as a doctor, you know something, but not to that level. The only way that you really want to improve, learn yourself to become a nutritionist. And I think someone here asked me about Facebook, how to advise your patient diet. General advice, very simple. Talk to your doctor. And then the patient said, my doctor, don't talk about diet. He said, just go online. And then, oh my God, no. You as a doctor, learn about diet from today, okay? After this lecture, whatever time, learn about carbohydrate, fat, fiber, vegetable, learn basic so we can talk to a patient, all right? So let's keep going and finish our lecture here. All right, so when you will call a specialist, right? So this is the bottom line today lecture is now you see a lot of specialists out there, you see this and this. The question is when to call a specialist. Now, there's many reasons, okay? But here are the 4 most common reasons. Number 1, you have an initial diagnosis. What is initial diagnosis? That your impression when the patient first comes. All right, so let me stop right here and go back to the question that I asked you online. I showed you the picture right there, right? And let me go around the room and see who have or who tried to answer my question. Let's see here. All right, so let's put this. I have a picture here, and let me show you. Perhaps some of you see this picture already, but the question for all of you here is who or what specialist you would like to refer to if you see this picture. All right, and let me show you this picture. Did you see that my picture I post online somewhere under Facebook? Let me see if I have it right here. All right. Does anyone know the answer yet? All right, so let me call some number. Let me show you the picture, and then everyone can jump in and talk to me. All right, let's see. All right, can you see my picture? Can you see it? All right. Anyone recall I put this question online 2 days ago, right? So let's go around the room and say, what specialist you will call for this problem? You don't have to tell me the diagnosis, tell me out of hand. Hey, I will call this specialist. Okay, ready? Let's go around, have some time. Guys, come on, volunteer.
I think here the patient could come to see the cardiologist, oncologist. I mean, but it depends on the healthcare system. At the first time, they may come to see the general practitioner or internal medicine physician, and after that, they narrow the different diagnosis. You can come to the oncologist or cardiologist or pulmonologist.
Pulmonologist. See, very slowly.
Pulmonologist.
Yes. Okay.
Yeah.
All right. So you're absolutely correct. All right. And I like to pick someone else. All right, guys. Any idea? Any other idea? So we talk about pulmonologists, cardiologists. We talk about oncologists. Okay, so go ahead. I saw a name. 70s. Yeah, go ahead.
I will refer him to a pulmonologist.
Yeah.
And hematologist.
Hematologist. Okay.
And yeah, and maybe but I don't think he has cardiological etiology because he looked quite old, and usually with the heart defeat and cause that clubbing nail clubbing. The patient will not survive for too long. So I don't think a cardiologist could be a good reason, a specialist to see him. I think the pulmonologist is the right specialist.
Okay. Okay, hang on 1 second there. Who else? Okay, first of all, everyone know or should know this is clubbing, right? Everyone should know this, or should I tell you again? This is called clubbing. So where the nail folding abnormal, that's called clubbing. Okay, so this is the picture. This is actually my real patient. All right. And then we have pulmonologists, we have cardiologists, suppose we have oncologists. Okay. Who else? Tell me a reason why you think this is you need to refer to. Okay. I want more creative idea. Yes.
I think that we should advise him to go to the dermatologist.
Dermatologist. Okay. Now, okay. Some of you should know that I see this patient, so I'm dermatologist. So yes. Okay. And who else? Who have a good reason? Think about it.
I think other member in the class suggest the main reason a patient could be, but some a little percentage patient can go to visit and endocrinologist or gastroenterologist. Maybe a little patient can it could be not problem. Maybe mother or father of him have similar to finger in genetics doctor. A little percent patient not the illness is only genetic system.
Great. All right. So let me push the question more. Okay. So why the patient have clubbing, you think? What make this patient have clubbing? Because answer that question will essentially tell you what specialist you need to refer to, right? So why patient have clubbing? This question, I don't expect some of you know it, but tell me why you think the patient have clubbing?
Can I answer this question?
Yeah, please, yes.
Okay, what I learned from the common disease, which cause nail clubbing, is COPD. And COPD have an important role calling many different symptoms in the patient with COPD, which include nail clubbing. And the nail clubbing is because the vascular system surrounding the nails is it's called neoplastic.
Okay.
Neoplastic. They increase the volume of the vascular system and the tissue around the nails. What caused this? What caused the increasement of the tissue? It's because some growth factor, and this growth factor increase by the low oxygen in the blood, and the low oxygen in the blood increase the growth factor.
All right.
Yep.
Very good. So guys, let me go back to the lecture and tell you why I asked you those questions. Well, because in order for you to call a specialist, you should have an initial diagnosis.
Yeah.
So what you just telling? Yeah. So what you're telling me? Huh?
Can I say something? Yeah.
Yes. Yes.
Yeah. I'm not a doctor, so in my opinion, I think that that's only the shape of the finger of the patient. We not enough information to make decision that which specialist we need to refer him to. So I think the first he should to see like general practitioner to make more like a clinical examination. Yeah, I know that like.
All right, so I don't know if hello. Well,
more clinical examination. We need more information about him to make decision that which specialist we need to refer him to.
Very good, and which is I will get back to that point. But all of your ideas are excellent. Okay, that could telling me that you're thinking something about the diagnosis, right? So let's go back to this. Now, here we call initial diagnosis. That means the first time the patient comes to see you, whether you want to send him to see a family doctor, a general practitioner, or a cardiologist, or a pulmonologist, or an oncologist. Whatever it is, you have something in your mind, right? So you think this is symptom called clubbing, and likely due to some abnormality of the vessel that someone told me, and I agree with the nail system, within the nail bed. So that's your initial diagnosis, okay? Now, while you talking to the patient, you order some lab, and no things still change. So you think you call this a working diagnosis. Make sense? If you found something on your way and you think, no, this is not clubbing anymore, could be something else. He just banged his nail by himself, so that's not clubbing, this is something else. So you change your working diagnosis, but initial diagnosis, working diagnosis, and then you can tell, you can call, especially if there's symptom of unknown disease. You don't know what the heck is that, you know what, oh, I don't know, not sure, but this is weird to me. Patient have fever and he's have fever 102 degrees and he's crashing, his heart rate went up. Whatever reason out there, you don't know, or you think you know something, you need to call a specialist. Or you think the point is you need to call the correct one. When I ask you to call a specialist, you don't call 160 specialists in the hospital, right? Assume you will have everyone. Well, you don't want to call a pediatrician to come to see this patient, right? You're unlikely to call a gynecologist to see the patient. Maybe same problem there, but you would not likely to call. So you have to pick the good one, right? So that is today. You need to think about your diagnosis. What is the most likely and you refer to? So that's one good example to see that. Now, when we talk about this patient and this, today we talk about medical English, but in real life, this is my patient. She or he will refer to see me as a dermatologist because though you can see not only here clubbing, but he did have hyperpigmented line, the vertical line here. And that's why I need to work him up. And how do you call a specialist? So this is one of the last slides, but I want you to focus on this because now we talk about all the specialists. And when I say specialist, I mean non-physician also. PT, OT, pharmacist, whatever. You should have a patient name, right? You don't want to call me 2 in the morning, Dr. Tran, I have this. and then you forget to tell me the patient name or patient room, I will be very disappointed if you are my fellow or my residents, okay? Because next thing I will yell at you and say, you know what, it's 2 a.m. and you're not telling me where the patient, how in the world I can find the patient. So make sure you, when you call a specialist, have the patient name, ID, room number, and a brief impression why you think you need to call a specialist. When you call a cardiologist, in your mind, you need to think, this is an acute cardiomyopathy infection, acute MI, okay, myocardial infarction. You don't call a cardiologist and say, hey, I think he has chest pain. That no one like that. They really want to see this is acute MI or be very specific, non-STMI, something very specific. The patient needs CAT, something like that, because you have an idea. You don't call a specialist because the patient come with chest pain. Can you come and see? Yeah, it could be a good idea, but a better idea would be, doctor, I think the patient have acute non-STMI, something like that. So the cardiologist have a very good idea that you are working to the diagnosis. You talk about initial symptom, why the patient come to the hospital or come to the clinic, lab and your physical finding. And then lastly, again, remember, you talk about your impression and you bring a very good question. Dr. Tran, you think the patient had acute MI non-ST, something like that. Very specific. Patient call me, Dr. Tran, do the patient have acute flare-up lupus erythematosus due to drug? A very specific question, and I love that consult. Don't call me, say, oh, patient may have positive ANA. You know, those are very general. We want a very specific question. All right, so let me go back to the class again. We have about 50 minutes, and then I'd like you to tell me. Now we're going to go back to your time because we talk about specialty, specialists. We go back to nurses. We go back to pharmacists. We go back to PT. And I want to hear some voices that I never or have not heard anything. Let's see. Can anyone or can the team leader from, let's see. How about number 18? 18, are you here?
I'm here.
Okay, 18. Can you tell me what is your specialty?
Hello, teacher and class. I'm an anesthesiologist.
Excellent. So you're an anesthesiologist. Okay. Let me ask you one more question. Do you subspecialize or are you a general anesthesiologist?
I'm working in obstetrics and gynecologist hospital. So I'm working usually
all right. So let me hold on one there. Okay. Just put your mic on. Now we have anesthesiologists. Do we have any surgeons, any surgical specialty here? Any surgeon? Can you raise your hand? Not my hand, raise your hand. Any surgeon in this class? I should have one, right? Let's see. Where my surgical team? Dr. Din, can you tell me where's my surgical team? I'm sure there's a surgical team somewhere here.
I am surgical team, but I'm not surgeon.
Oh, so you're a surgical team, but you're not surgeon. Okay. All right. Well, I guess the surgeon is too busy, so they don't go to this class where they operating the patient right now.
You know, when I assign the team for the participants, I don't care about what their specialty. So just, randomly pick up their team. So it's surgical team, maybe not surgeon there.
Okay, no problem. This is good to know. All right, guys. Anyone here want to become a surgeon? Okay. None of you want to become a surgeon? Seriously, I think this is one of the most fun specialty that in medical school. or at least on Grey Anatomy, or at least on Korean movie. All right. No one want to become a surgical. Let's see. Wow, I don't have anyone here want to become a surgeon.
Good evening, teacher.
Yes. Okay, so you want, okay, go ahead. Yes.
I am Dr. Khánh.
Okay.
I'm in team 7 endocrinology, but I am a traditional medicine doctor. I use acupuncture and herbal medicine for treatment. And I don't know my in specialist what is specialist. What is my specialist?
Oh, so you are wondering
because,
what is your specialty or your specialist, right? You are
yes.
Oriental medicine or traditional medicine.
Oriental.
Can I,
Oh,
excuse me?
Thank you, doctor.
Can I call the Oriental doctors as a TCM, traditional Chinese medicine doctor?
Yes, you can call that. But we try not to bring a name. In general, a Chinese medicine doctor is a good one because that's so broad. But how about Vietnamese medicine? So I try to do Oriental, and in fact, in California, we use Oriental to designate Asians' interest in medicine. I think it's a better term because we not focus on geographic or name of the country, but rather a philosophy. And here we have Oriental philosophy, focusing on acupuncture, drugs that they use our bowel system, so coining, so those kind of things that more like Oriental medicines.
Okay.
All right. So there is no surgeon in this class. Well, I'm a little bit surprised. Usually in my class, I think sometimes I do have surgeon, and they have a very why I mentioned surgery here, because surgeon in general, they have a quite interesting mentality. They're not crazy, okay? I call one of my friends, a good friend, a surgeon, orthopedic surgeon, and I don't call him crazy, but they're thinking a little bit different. And let me tell you how different it is, because they focus so much on the technical aspect of the patient. They're really good at hand, okay? They can cut things perfectly. They can put the thing back perfectly, but that's it. Usually, because that's their focus, really. They're training in 5-year residency, doing a lot of cutting, and they do medicine too, but not a lot like internal medicine doctor, because we think a lot, but we don't do anything. They do many things, but they don't think a lot. That's different. But we all need each other. All right. So let's see who else I haven't. And this is I like to spend the rest of this class just talk to you guys and freely, because we are going to be together like this in the next at least 10 more weeks, right? We have 16, so we have 14 weeks ahead. This is your time to talk to me in Vietnamese if you want, because I know that some of you are afraid and don't want to speak English, or I got it. So if you really want to tell me something, this is your time. And as I said, this is your time. You really want to voice your concern. Let me tell you, my student, I teach medical student. I also teach resident. And the funny thing about my student here, they all raise their hand. And I will tell you, they keep asking questions and after. So I really want you to think about it, because this is your time. I'm here to help you. Okay, I'm here to share with you my experience, and you can ask me whatever question that in medical English or non-medical English, it's fine. All right, I saw a hand right there, number 62, please.
Yeah, I have a question. In your handout, I see the nephrologist and urologist, and I want to ask you about the difference between them. According to my search on Google, I see nephrologist means the physician treat kidney disease using medication and fluid. And I think maybe the nephrologist belong to internal medicine.
You're right. You're correct. Yes.
Yeah, and I think in contrast, urologist can perform surgery like remove stone in the kidney. It is correct. I want to ask you to confirm that again. Yeah.
Excellent comparison, because those are two related, especially but different approach. One using medicine to fix the kidney and urinary tract, the bladder, the ureter. The other one use surgery. So one guy wants to use medicine to fix problem with the kidney. The other guy, hey, I just want to cut it. I want to open it. I want to fix it. But either way, you need both, because urologists are surgeon. Okay, they do 5-year residency to learn just to operate on the bladder, on the ureter, on the opening of the ureter system, versus nephrologists. Also, they did 3-year residency in internal medicine, and they do 2-year fellowship in nephrology. So another 5 years. So they're equal. All right. Any other questions?
Hello, Wynn.
Yeah.
We just have a few minutes left, but because from the beginning until now, I still hear some students, some participants still not pronounce correctly the specialist. So I would like to call some of them and just ask them to pronounce their specialty.
Yes.
So we try and we want to brush out how today you pronounce it. Is this okay for you? Because yeah. Okay, are you ready? So I just ask you, one, you introduce your name, say that I am am Dr. Bing, that's it, and then cardiologist, or I Dr. Min, gastroenterologist. That's it. I would like to hear from you how you pronounce it correctly, because it's very important that you have to pronounce correctly your specialty. Are you okay with that? Very quick one, everyone. Just about a few seconds for everyone. Okay. Now, number 22, Lê Thanh Tú.
Yes. Hello, teacher. Hello, everyone. I'm Tu. I'm a nurse.
No. Don't say. Okay. Stop, Tu.
Yeah.
Rất lòng thầm. Tôi nói tiếng Việt nha. Việt Nam mình rất lòng thầm. Em chỉ nói thẳng vào. Em Dr. Tu. Cái gì đó. Hello, teacher. Hi, everyone. I am 18 years old. I am graduate from. No, don't need to use that. Okay. Now, go ahead.
Hello, teacher.
No.
No
hello at all. You suppose you introduce yourself to the patient. So what you say?
Yeah, I'm Tu. I'm a cardiologist.
Good. Okay, stop. That's it. Okay, I'm Dr. Tu. Okay.
Yeah.
Don't say M2. It's not good at all because you're professional. So I'm Dr. Tu, cardiologist. Okay. Now next 40.
I'm Dr. Dung, pediatrician.
Good. Okay. Now, 59.
I'm Dr. Vanang. I'm infectious disease physician.
Again?
I am infectious disease physician.
Okay, now just say, okay, in pronunciation, you should pronounce a bit clearly. Infectious disease physician. Okay.
Infectious disease physician.
Good. Very good. Okay.
Thank you.
Say Dr. Tran, Dr. Wynn already. You have to speak slowly, clearly, your specialty. Okay, number 10, Amin Tran.
I'm Dr. Chang, gastroenterologist.
Again?
I'm Dr. Chang, gastroenterologist.
Okay. I believe that you are a Northerner, huh? Người Bắc phải không?
Yes, yes.
Okay,
yes.
okay. So gastro, not gastro. Cho is nothing in English. Cho. Huh? Gastroenterologist. Gastroenterologist.
Yes.
Okay, good. Okay. Now, Đào Minh Tùng, number 6.
Yes. Hi, I am the medical emergency doctor. So it's the first time I say.
Okay, that's it. Number 1, you forget your name. The patient needs your name. So you introduce your specialty. So again, okay, do it again. Do it again, Tùng. Number 6.
Sorry. Hi, I am your doctor. So I am emergency doctor.
You still forgot your name. Again.
Sorry. I am doctor. I am your emergency doctor. So.
Wrong. You make a big mistake. When you see the patient, always say your name. Always say your name, because after that, if the patient want to sue you, yes, they don't know your name. Okay.
Okay. Sorry. I am Tum. I am emergency doctor.
Okay. Good. Now, I am Dr. Tum, emergency doctor. Okay. That's it. Very clear and precise. Okay. Now, one last before I give the job to back to Wynn again. Okay. 46. Thanh Hiền.
I'm Dr. Hiền. I am emergency doctor.
Okay. When you introduce yourself with your Vietnamese name, try to pronounce clearly, because otherwise the foreigner cannot catch your name. Okay, say that. Don't say that I am Dr. Hiền. They don't know who are you. I am Dr. Hiền. Okay, emergency doctor, or I am Dr. Hiền, H-I-E-N. You spell your name. Okay, so make sure that the patient catch your name. Okay. Before I give hand back to Dr. Wynn, I just say that this is your homework. Everybody make the short video clip. Self-introduce. That is, say your name and your specialty for me. For medical students, you can pick any specialty you like. Okay, so that's it. These are for homework this week. Okay, thank you, Wynn.
All right, and here's the bonus. If you can say otolaryngology, ENT would be a big one. Okay, so otolaryngology. Okay, so ENT. You can impress your friends. Say, hey, I'm an otolaryngologist. You say really fast. You say, I'm an otolaryngologist. And people say, what the heck is that? Well, it's an ENT doctor. Okay, so that's how you say your specialty. All right, I have a question here. Dr. Wynn, could I ask you about what do psychiatrists do in the US? What the difference between them and psychologists? Okay, psychiatrists are medical doctor, physicians.
Psychiatrists, sorry.
All right, psychologists are not medical doctor. They are PhD or they have a doctor degree in psychology. So psychiatrists, we see patients, we consult, we talk to them, and we give medication. Psychologists do not prescribe medication, but they can consult, they can talk. So I will tell you a very easy to remember. Most doctor, when they talk about mental illness, if they can prescribe medication, they are psychiatrists. If they cannot, they are psychologists. Okay, and we need both of them work together. Now, a psychiatrist take about 12 years to finish 4-year college, 4-year medical school, and 4-year residency. A psychologist take about 10 years or 8 years, depends on how you do. But 4-year undergraduate and 4 to 5 years a PhD in psychology, or a doctor of psychology, also 4 to 5 years. Sometimes they do 1-year residency, but 10 years total. So psychiatrist 12 years, psychologist 10 years. Okay, and they both doctor, but one can prescribe medication, one cannot. All right. Any other question for me? And as I said, you guys feel free to ask because this is your time. Let me ask you this. Is this, I don't know, other instructor teach you how, but are you okay if I'm talking only in English? Are you okay or you do not understand? Tell me.
Yeah, I feel okay because I can understand also what you say, and I think it's really good chance to practice listening English. Yeah.
Thank you. Thank you. This class we call basic medical English, but we hope that you have a background in English already. Am I correct? If you are just know barely English, you may be in the wrong class. So I may speak sometime advanced terminology, but still go back to basic one. When you come to advanced medical English class, it's not going to be like this. You have to tell me a lot. You have to tell me the diagnosis. What is the differential diagnosis? Why you think the patient have? And argue with me, Dr. Tran, I don't think this is a good treatment because that's advanced medical English. Okay, and that will be next year. And I hope some of you will follow me to go to next year because to be honest with you, that's the best part of medicine. I love talk to my resident every day because I learn so much from that. I give assignment to my resident and some of them come with a very good answer. And sometimes I can't even think about it. And let me tell you something very fun just a few days ago. All right, and don't laugh, okay? I have a patient who a porn star, a real porn star, okay? And think about it. A patient porn star come to you because erectile dysfunction. And the treatment you use, sildenafil or Viagra doesn't work. So I tell my resident, okay, so what the treatment for this if Viagra doesn't work? And just to tell you, porn star are professional, professional porn star. They work hours to make a 5-minute video, whatever you think out there. So the resident come with me, Dr. Tran, actually there's a newer treatment. And I say, what is that treatment? And she present to me a very impressive way that they can inject medication directly into that to make the patient correct the problem with erectile dysfunction. And I said, wow, that's very impressive. And this treatment actually not FDA approved, but they use a lot. So to tell you, as a resident, you guys have a lot of idea, a lot of treatment plan. And when the attending asks you what to do, you have to think, and I asked her, why do you think this is a safe treatment? And the resident very impressively tell me, Dr. Tran, based on this and this and this, I think that could be a good treatment. So to tell you, sometimes advanced medical English, you have to put together a lot. It's not just this one, but you really make a case. But in this class, I'm okay with you to introduce yourself and say hi to me. It's okay. And in the next few weeks, I want more, okay? I want more from you. You don't look at me in the screen and smile. I can smile back, but look at me and talk to me more. I am Dr. Tung. I'm an emergency doctor. Dr. Tran, there's a case right here I want to tell you. The patient present with chest pain for 3 days. I called cardiologist, but the cardiologist did not think so. Something like that. I want you to really go too deep into that. All right. Any questions so far?
I have a question.
Yes.
Actually, if you use English in this course, it's okay. But I wonder that how is on Vietnamese level, and because I never hear you speak Vietnamese, so I will ask one question in Vietnamese and khóa sau ấy ạ thì em cảm giác như là khóa này sẽ focus vào bác sĩ nhiều hơn, thì như bọn em là vật lý trị liệu thì bọn em có thể tham gia được hay không? Tại vì là nếu mà focus vào kiểu như là chẩn đoán rồi là các cái nó chuyên sâu hơn về bác sĩ thì không biết là những cái ví dụ như những chuyên môn khác như là vật lý trị liệu hay là điều dưỡng thì có thể tham gia không ạ?
You want me to answer in English or Vietnamese?
No, in Vietnamese, please.
Okay, sure. Okay, guys. Okay. Cái khóa này thưa các anh chị là cái mục tiêu của chúng tôi là dạy cho những anh chị đây là những cái từ chuyên ngành tiếng Anh cơ bản. Thành ra chúng tôi nghĩ rằng là những người không phải là bác sĩ vẫn có thể học khóa này. Lý do tại sao mà tôi nhắc nhiều về những cái rất là cơ bản, ví dụ như là giới thiệu về bản thân, về chuyên khoa, về những cái từ này. Chứ nếu khóa này mà là chuyên về bác sĩ, tôi nói khác hơn và tôi nói rất là sâu. Tôi nói ví dụ nếu mà lúc nãy chúng ta nói về bệnh, tôi sẽ hỏi tới cái sinh lý bệnh, cái pathophysiology, go sâu tới cái mức mà bệnh gene là cái gene nào có thể gây ra cái clumping, ví dụ là như vậy. Nhưng mà ở đây chúng ta đang nói về rất là chung với nhau, thành hy vọng là các anh chị ở đây đừng có ngại mình không phải là bác sĩ hoặc là mình là bác sĩ, không sao hết. Quý vị anh chị ở đây có thể đặt câu hỏi với chúng tôi. Ok.
Bổ sung thêm với Wynn đó là các học viên, các em ở đây đó là chúng tôi chọn từ nhiều cái ngành khác nhau và mục đích là để giới thiệu cái thuật ngữ thôi. Do đó là không có đi sâu đâu. Nhưng mà lên cái lớp tới đó thì đúng ra là chỉ để dành cho bác sĩ thôi. Không phải là không thích những người khác, nhưng mà chỉ có bác sĩ mới có cái kiến thức để mà thảo luận cái đó. Do đó cái lớp này là lớp chung, tất cả mọi người đều có thể tiếp cận như vậy.
Any questions? All right, I found this. Go ahead.
My last question. I saw on your slide you compare the nurse and doctor, and you write that the nurse can prescribe medication. Is
Yes.
It right? Yes. It's really surprise to me, because in Vietnam I don't see any nurse can prescribe medication. And yes, give me detail about that.
They will in the future. And let me tell you why, because I do have 2 nurse practitioners in my office. We call nurse practitioner. They master doctor level. So they finish nursing school. They go for advanced training. They finish the advanced training. They take a board. They become certified and they have their own license. So yes, the answer, they can prescribe medication. Now, the common medication is okay, but sometimes substance control, opioid, they usually ask me to make sure that they're okay to prescribe. A lot of medication, for example, biologics, in my specialty, very expensive medication. Usually the pharmacy only dispense if it comes from the specialist doctor, because they just want to make sure that the patient had been consulted completely about medication side effect, as well as why the patient used that drug. But this class, as mentioned earlier, I'm happy to see many specialty here, non-physician versus physician, because that's who we are. We are a team, guys. I want to tell you again, we're a team. We work together. And if you look at the model that people have been proposing, Doctor actually not on the top. You know who on the center is patient. Patient in the center, and we are surrounding the patient. And physician usually the leader. We take care of that, but we need everyone. That's how I see it. So hopefully from this class, I will show you how we practice medicine here and how we approach a team with multiple specialty. Okay, number 40.
I'm sorry, it is not a question. I'm only answer the homework that Mr. Dean gave me last week. CBC and CMP. What is abbreviation in medical English? My answer is CMP is comprehensive metabolism panel, and CBC is complete blood count. Thank Mr. Dean. Before because I have that source, some abbreviation, but I not find. But after you gave my exercise, I try more way to find the answer. Thank you.
Okay, thank you. Good for you. But tell you, next week we off because of Thanksgiving. Okay, so you have more time. Okay.
All right. And guys, let me tell you, number 40. Let me give you one comment very quick. When you talk to patient or talk to me, do not, and I repeat again, do not scratch your hand or here. This is very common for students in Vietnam, but it looks very unprofessional in the US for two reasons. Number one, it sounds like you have something itchy in your hair. You either have a scalp dermatitis or you have psoriasis. In my differential diagnosis, I mean, long one, if you scratch your hair. But the patient won't like it because if you scratch your hair in front of the patient, it sounds you're not confident. And secondly, your hand dirty. So in the future, if you talk to me on this, pretending you talk to your real attending, so talk professionally and try to look directly into the camera, smile, and talk. This class, we not only teach you medical English, but we show you how we interact professionally with our patient, how we talk to each other. And that's why you see me, when I talk to you, this is how I treat you, like real patient, real resident, real fellow, real colleague, real student, right here. And that's I told my student all the time. Make sure that every time you go to Zoom, treat like you are seeing your real attending in real life. Okay, that's how you get a habit. Because someday, if you keep scratching your hand or do whatever, when you see a patient, you do it, that's not very cool. Okay, and I give you a quick feedback. And if I see anything, I'll give you feedback right away. So everyone, and I see that sometimes. So talk to me, smile, focus on the camera, and talk, practice. Okay, guys, any question before we take off?
Thank Dr. Wynn.
Okay.
I clear my hair.
Yes.
Hi, Dr. Wynn.
Yes.
You just talked something about nurse practitioner. Maybe that's the same my situation now. You know, before I like the assistant, and after work in hospital 5 years like a nurse, and then I studied for more years to be a doctor. Now currently I have been working like a doctor. Maybe that's the nurse practitioner, the same my situation now. Ở Việt Nam người ta gọi là học liên thông đó, Dr. Wynn.
Well, so the question for you, what degree they offer you at the end of the course?
Currently, I have the bachelor degree.
Yes, but you're telling me that you are studying to become doctor. Was it medical doctor or doctor of nursing?
Medical doctor.
Okay, so now you become a doctor, a medical doctor. You're not a nurse practitioner, because nurse practitioner are different degree. So you have a bachelor degree in nursing, and now you study further, more advanced. You study in master or doctor level, but still in nursing. That's called MSN, Master of Science in Nursing, and that makes you become a nurse practitioner.
I'm sorry, that's something make me confusion.
Okay, I hope that's not confusing. Is that still confusing?
Yeah, now I'm clear. Now I'm clear.
Okay, good. All right, very good.
Teacher?
Okay. Yeah.
I think it's quite late in your country, but I have a question.
Yes.
Because in Vietnam now is we are celebrating Teachers Day, and I want to be with you and our teacher in class all a good thing, but I want to know in your country, in US, have a 80-day license in Vietnam 2011. Thank you very much.
All right, the short answer is no. We do not. We have different days. We have different day for professional. We have doctor's day. We have nurses day. We have different day. We also have other professional day. But in general, we do not have teacher days. So I appreciate. I thank you for all your best wishes during this day, because every year I do receive wishes from my student from Vietnam, and I cannot believe it's been a long time. My student now become attending. They become some of them very successful doctor in Vietnam. Some of them are finishing fellowship, become attending here. So it's a long journey. So I hope this class will continue, and I hope we will see each other in real life somehow, some way later in life. And I hope to keep in touch with all of you, because I wish you the very best out there. And I believe every single of you will become a very successful person in the future, whether you are a PT, a nurse, a pharmacist, or specialist. Okay. And I hope that we'll continue to keep in touch. And I will see you. I don't know what lecture next. Dr. Din, you may remind me, but I think I will see you.
You still have 2 sessions that teach those people. Okay.
Wow. Okay. More. So 2 more. Okay. At least 2 more, but I'm here. If you have any question or anything, and then as I say, practice. Okay, guys, practice is the best way for you to keep up with your medical English. After today, try to talk to everyone. Talk to your girlfriend, your boyfriend in medical English, and see what the reaction is. I mean, they may hate you, but I'm just kidding. They like you more, okay? Because it's fun. I'll tell you, it's fun to practice and then talk to your friend. My assignment has been told by Dr. Dean already, but you guys talk to your team among yourself and say this and this and try to improve, because we just started. But I hope in the next few weeks, you continue to improve your English by talking to your peer, to your colleagues, to your attending, to your resident, to your loved ones, anyone you can think of in medical English. Okay, guys?
Yes, thank you, teacher.
All right. Have a nice day, everyone. And I see you soon. Bye-bye.
Bye.
Bye.
Bye.